Describe antecedent and setting event strategies. Antecedent strategies directly modify, adapt triggers so that the problem behavior is no longer relevant. Antecedent strategies should be clearly preventative and used prior to the problem behavior being displayed. Antecedent strategies should address antecedents identified in the FBA. For example, to prevent challenging behavior triggered by teacher asking a student to read aloud, the teacher no longer asks the student to read aloud and only asks them to read privately. Setting event strategies involve either eliminating or neutralizing setting events, if any have been identified. For example, if a setting event involves a student being hungry, for example missing breakfast, the teacher may offer the student a snack to eliminate the setting event. Or if a student often comes into school upset, a teacher may take time to check in with the student and talk to neutralize the impact of the setting event. Include enough detail for a stranger to implement. Include who is doing the intervention, when, related to the antecedent, the strategy is implemented, and how, including verbal and motor behaviors of adults. These are IEP tips. For a student with an IEP, the ARC should include setting events and antecedents for the problem behavior in the present levels of performance. Consider whether staff training is needed to implement setting event and antecedent strategies, and address this in the IEP documented as program modifications and supports for school personnel. Consider whether student instruction is needed to use the setting event and antecedent strategies, and address this in IEP documented as specially designed instruction. Consider whether the student needs strategies and other supports provided in the general education environment or other educational settings to gain access to the general curriculum, and address in IEP documented as supplementary aids and services.